Welcome back. Stress may be the first feeling many people have when thinking about the holiday season, especially if you're undergoing something like cancer treatment. But there are expert ways to cope with that and enjoy the holidays even through hectic times.
That's right. Arizona Oncology social worker Carrie Reeves has spent years helping cancer patients, and she's joining us now with some tips. It's great to have you here.
Thank you for having me.
So obviously it is a very hectic time, and people stress out during the holidays, which they shouldn't, because now it's a time to, be with family and be happy, but it can be a real struggle for people who have cancer, I would imagine. So talk about some of the emotional difficulties, maybe physical difficulties that they may be going through right now.
So with the physical difficulties with fighting cancer, you're going to get a lot of the fatigue. You're going to get a lot of just not feeling well, achy feelings. Maybe after chemo you have that nausea and vomiting and stomach upset. But the emotional needs with fighting cancer, that's 90% of your battle. You get the depression, you want to hide from your family. If your hair is falling out, as a woman, that's horrifying. And so you don't want to leave the house. And the fatigue side of it as well, when you're fighting cancer, that impacts the emotional well-being. And you see a lot of depression, a lot of sadness, a lot of anxiety, and a lot of loss of control. And so it's helping patients regain that control over their lives before they can take that step forward.
So what advice would you give them to sort of alleviate some of these difficult emotions?
So fighting the invasive thoughts is huge. I know I probably have a lot of patients out there laughing right now because I see it time and time and time again. Those invasive thoughts can be so overwhelming sometimes, of the what ifs. So acknowledging the invasive thought and turning it around. So what if I'm not going to feel well on Christmas Day? What if I do feel good on Christmas Day? So fighting those invasive thoughts, turning around the what ifs, and being patient with yourself. This is a hard balance. Yeah.
Right. And when you're battling the blues, sometimes it can be a hamster wheel, I think, because one negative thought builds on another negative thought, and before you know it, it's just, escalated out of control. So what are some of the tips maybe to stop that cycle of being sad?
So continuing to do what you enjoy within the limits, right? So if you enjoy decorating the Christmas tree, sit back and watch your family decorate the Christmas tree if you get tired doing it. If you enjoy going to Winter Haven, walking through Winter Haven, what if this year you drive through Winter Haven? So let's not allow cancer to take total control of our lives. It's about fighting it emotionally as well, because like I said, it's 90% of the battle is what goes on in our head.
Yeah, and aside from the fact that someone is going through treatment or they're feeling uncomfortable, the financial struggles are sort of on top of that too. So how can people start to deal with that and maybe some strategies to sort of get past it?
Yeah.
So open up. You need to talk to somebody if you're struggling. Financial struggles are often seen as a shame, and we don't want to talk about them. We want to keep it to ourselves and not answer the bill collector's phone calls. Speak up, because there are programs out there to help you. I know of a couple of credit card companies will excuse the debt if something catastrophic like cancer happens in your life. Call the social workers in the office, call the financial advisors. There's programs in order to get free medication, and we can help you qualify for that, and seeing what else you can qualify for. There's a ton of resources in our community that can financially give you that money to help you with gas, or give you money to help bring food into the home, or even pay for co-pays. But unless you speak up, we don't know.
Well, and I think a lot of people don't know that they can reach out to you. Maybe they do want to speak up, but they don't know that they have that lifeline that's accessible, and that's what Arizona Oncology has.
Right.
They can talk to you personally.
Absolutely, anytime.
The benefit of a social worker in a situation like this, I mean, it's immeasurable, right? You have someone, like we're saying, to talk to.
Social work is huge in the oncology field, and social work is becoming newer and newer into the different medical fields, because they've seen it as an asset. It takes the stress off the doctors and off the nurses so they can focus on what they need to do. But then we have that training in order to provide them the support and comfort that they need, and connect them with community resources out there.
Well, and finances, that's the last thing you need to be worried about, because it does take an emotional, physical toll when you're worried about something like that.
It does. The amount of anxiety our patients feel just from those bill collectors calling and calling.
It's all about support. I mean, be it, of course, a social worker, family and friends are huge. As family and friends, you can be a big support for somebody going through this. So definitely something to keep in mind. Nice to see you. Thanks for being here.
Thank you for having me.
For more information about Arizona Oncology and their 7 locations here in Tucson and Green Valley, visit ArizonaOncology.com. ArizonaOncologyFoundation.com and visit ArizonaOncologyFoundation.org for more local cancer support and services designed to help you through treatment and survivorship.